the next type of pain that most commonly gets confused with probably disc issues, because it's just a really chronic pain that just kind of spreads across the whole lower back, are what's called facet or arthritic pain. So your facets are the joints that are actually in the back. So like when I'm pushing on someone's back, the big bump in the back is called a spinous process, but right off to the side of that are called facet joints. And that's how the spine actually stacks on top of each other. That those are also like guardrails to the spine. So, that's why you can't do a 360 as you're turning around, right? You have a certain amount of range of motion that you're supposed to have, but it's also not an extreme range of motion where things just dislocate on their own, right? So it's like a guardrail. The problem is when oftentimes because of postural issues or weight is a big part of that. That's where people like are really typically leaning back a lot. So most classically we'll see, the head and shoulders kind of round forward, and then somebody as they're standing will lean back, right? What that person is doing is really loading up those joints in the lower back. Imagine constantly doing like a back bend or where you're arching your back. Those joints just get compressed, and that can cause arthritis and degeneration a lot faster in the spine. So most classically, it's the, lower back pain right in the middle of the lower back. It doesn't come into the butt or down the legs. It's worse when you try to lean back. It's also worse when you've been standing. Like if you've been standing for a long period of time, or you've been walking for a long period of time, and then your lower back is just killing you. That's very commonly coming from these facet joints. And then it feels better when you're sitting or bending forward.